This is Sahar Afshan again with Maternal and Child Health Part 2. Let me introduce myself. I am Dr. Sahar Afshan, Public Health Specialist, Canada. Currently working and studying public health at the same time. And student from SMC 2010 graduate. Love my institute, would love to contribute more and more. The last time we did, we started with maternal and child health because I think, and we started in the context of family medicine and what is community medicine, giving you an introduction. So let me go through it again. What is community medicine, just to fast, just a recap so that students who are tuning in into the second part directly, you know what we are talking about. Community medicine, how I'm taking it, is a part of, it's an amazing combination of family medicine and public health. So that's why we call it community medicine. It's a medicine of prevention and control. It's somebody once said to me, and I think I previously repeat as well, being a family physician, especially because I'm a family physician by profession, previously doing family medicine all these years, that when you're a physician, you treat one patient. And when you are a public health specialist or a community health specialist, you treat the entire population. You prevent the entire population from the same disease. So it's just another amazing form of it. So community medicine is an important topic of medical professional life, especially people who are taking, students who are going to be taking general medicine, general practitioner, being, they will be practicing as GP doctors and family physicians. Community medicine would be one of the core components of practice. So this is how we're going to be taking our topics. So today, in the context of maternal and child health, community and family medicine, previously we did maternal and child health care, what it's about, how the Pakistani system works, what is important from examination point of views, all the other factors. So we did one part previously. You can find the videos out there linked. Today, we're going to be doing a short video about reproductive health and family planning, a very important component of maternal and child health, a very common practice in for GP doctors and family physicians. When I was in a family physician in Saudi Arabia, this was just every second patient used to be of gynae patients. We used to get antenatal care, reproductive health, and family planning issues to discuss with our patient. So it's an important topic, but we'll take more of an examination approach and a practical approach, something concise that works for you students at fourth year level. So let's start with what is reproductive health. Reproductive health is the state of complete physical, mental, and social well-being. And it's just not the fact it's an absence of disease, no. It's emotional stability, physical stability, a healthy state of mind where women is open to the fact that, open to pregnancy and the consequences that follows. So basically, what are the components of reproductive health? Maternal health, that is contraception, family planning falls under it. Sexually transmitted diseases, HIV, AIDS, so many other diseases, herpes, etc. Abortion, female genital mutilation, child and forced marriage, malignancies, I got that up, it's a separate one. Newborn care, all these are components of maternal health. When you would be practicing as a family physician, you would come across these common practices of every day in your practice, and you would have to deal with them. But just from a fourth year student perspective, it's just, we would say that they are the components of reproductive health. So another factor from, again, examination point of view would be why reproductive health is important and why is it so underrated, yet especially in Pakistan, the low socioeconomic countries. The fact that maternal death ratio is not getting any less in Pakistan. So And maternal death determines the women health of a society. So what is maternal death? It is defined as the death of a woman while she's pregnant or within 2 days of termination of pregnancy. By termination of pregnancy, we mean delivery, abortion, miscarriage, whatever, but termination of pregnancy within 2 days. If a woman dies within this time, she's considered as maternal death. What are the common causes? Hemorrhage is the most common cause. Hemorrhage, postpartum hemorrhage, placenta previa, um, retention of membranes during pregnancy, etc. The most common cause of death, maternal death, is hemorrhages. And once you would be having rotations in gynae ward, you would see how common this issue is. Eclampsia, that is hypertensive pregnancy, is another second big factor, contributing factor towards maternal death. Obstructive labor, it could be multiple factors: short pelvis to small pelvis to child ratio, or prolonged labor. All these causes complications in pregnancy, obstetrics, and hence we call it obstructed labor. Sepsis, the hospital condition, especially the tertiary care hospitals, government hospitals, they're not the best when it comes to hygiene. So sepsis is very common during pregnancies, and they eventually causes maternal death. Lack of adequate healthcare and family planning. Family planning, by family planning, we mean consecutive childbirths without proper gapping, that causes deterioration of mother health, which eventually leads to anemic pregnancies and death of the mother. Lack of adequate healthcare, we mean basically lack of facilities, lack of roads available in the rural areas, lack of transportation, the accessibility to medical professionals. All these factors contribute to maternal health. Another big one is lack of skilled labor and emergency care. That is, a lot of people prefer, especially in the rural areas, to have pregnancies by DIs or trained midwives. They're not very trained, they're so-called trained midwives, which leads to complications in pregnancy, hemorrhage, unprotected high-risk pregnancies, which eventually lead to maternal death. These are the common causes of maternal death. I've presented a statistics of how of statistics of women in a maternal rate of women in Pakistan, of maternal rate in Pakistan, which is not less than any other region, but still need to be controlled. Another factor that contributes to maternal death and maternal reproductive health issues is high-risk pregnancy. Once you would be conducting family medicine clinics or even having rotations in gynae, high-risk pregnancies are very common. You will come across a lot of cases for which a solid history, obstetric history, and medical history is very important, and you would be exposed to such cases. And that is where you start thinking critically as medical students. But just to have an idea of what are high-risk pregnancy that leads to reproductive health issues or maternal death contributions, are some of the factors that they're too young. We get a lot of cases in our practice where, especially typical rural areas, where the very young girls that are getting married, we call it child marriage as well, less than 18 years, they are high-risk pregnancy, and the others are too old, 35 years in primary gravida, that is having first primary gravida means first pregnancy. Prematurity, delivery of the child in less than 37 weeks. Short stature, that is height less than 5 feet. Twin pregnancies, also high-risk pregnancies. Junior doctors are not allowed to to deliver such pregnancies. They're always specialists for it. Senior residents who deliver twin pregnancy. Malpresentation, C-section is a must. That is breech. Anemia pregnancy, anemic pregnancies. Past bad obstetric history is another high-risk factor. If previously there was rupture of membranes and there was sepsis, hemorrhage, any other past bad obstetric history, procedure that went wrong, vacuum delivery went wrong, the women had to go through a lot of complications, that is another, in the next pregnancy, that is considered as a high-risk factor. And then similarly, pregnancy associated with Diseases, of course, diabetes, they all need specialist care, obstetrics for during their pregnancies. Heart disease, renal disease, epilepsy, and psychotic orders. What are the measures? Now, we know high-risk pregnancy, what is maternal death? But previously, before this, I'd like to go through one of my slides previously. Now, we just discussed what is maternal death. It is defined as death of a woman while she's pregnant or after termination of pregnancy after 2 days. But is an accident or an incident the cause of maternal death? No. If a woman gets hit by a car during the time that she was pregnant, that is not considered a maternal death. That is traumatic injury or direct trauma death. That is not maternal death. By maternal death, P means anything that happened during the pregnancy as a procedure to the pregnancy. That is maternal death. But just because of an accident, a fall, or any other trauma that happens to a woman, that is not considered as maternal death. Please keep this in mind, and you might have a question like this. How do you differentiate maternal pregnancy, maternal death from any other death? So how to reduce maternal mortality rate? First of all, early detection of risk cases. That is why going to health professionals is so important when it comes to pregnancy. Health professionals are keen about it. They're knowledgeable. They know how to detect risk factors, high-risk cases, and it makes the pregnancy easier and with specialized professionals. Broad birth spacing and family planning is another, because it helps with the mother health. When there are children with the proper gap, mother gets chance to recover from the previous pregnancy, mentally, emotionally, physically, nutritionally, in every way possible, before she is ready for another pregnancy. Small birth spacing causes complications, including mental depressions to physical complications as well. That is anemia and all. Fullest possible use of health resources. Once known that the woman is pregnant, she should be going to the clinics regularly, considering midwives, whatever resources she has. The family needs to make an effort. So she has to do it. Monitoring of maternal health status during pregnancy. A lot of women we see, even literate women, well-educated women in our societies, in their first pregnancy, they're very keen. But once they're done with the first pregnancy, they feel they're more experienced. In the second or third pregnancy, they're more careless. They're not visiting the doctors as much as they should. They're not taking their nutrition health care as much as they should. So there's a chance of negligence there. But they have to understand that monitoring of maternal health during pregnancy, first, second, third, or whatever it is very important, because every pregnancy is unique. And every time a woman needs to take preventive measures and be careful about her. Trained birth attendants, effective maternal child health services, increase in overall female literacy, increase in education. So just to keep it short and to the point, after maternal health, that is reproductive health, and maternal mortality, maternal death, we came to the fact, especially in low socioeconomic middle countries, that family planning is a very big contributing factor towards controlling maternal death. In Western countries, in European countries, the practice is very common because it's a different culture, it's a different trend as compared to our regions. So we need to really work on family clinics, family planning and contraception, because they reduces the chances of abortion, especially unsafe abortions, unwanted pregnancies, having the right birth space for the mother to recover from the previous one and to get ready for the other one, again, emotionally, physically, mentally, by preventing unintended pregnancies, family planning, contraception, we prevent overall death of mothers. So family planning is a very crucial component of community medicine, community health, and family medicine. And what are the common methods that are used? The Berry method condom is commonly used. It's the cheapest way as well. It's the easiest way. And a lot of people in general practice, they're very acceptable to it because they find it very convenient. So this is one of IUCDs, intrauterine device, contraceptive device is another factor. I think personally it's a very convenient factor, copper wire, etc. They give them, like it's not, they're more safer, 99.9% cases. Another is pills, but pills are estrogen, progesterone, combination pills, injections, hormonal injections, what we call. But again, there are chances they have side effects. They're not really accepted by patients as compared to the above two methods. The least common sterilization, vasectomy, and tubal ligation, because people are hesitant towards the fact that they just want to finish their reproductive cycle. So they're not very practiced, but in complications or willingness, we do that. Okay, another fact I would like to introduce to the students through this lecture is family planning, maternal health is very crucial for doctors, especially for GP doctors, family physicians. And with proper consent, doctor-patient relationship, trust, these are very, very effective measures for overall community health. And if a doctor knows what he or she is doing for their patients, for the betterment of the community, with trust, doctor-patient relationship, combined decision-making, and empathy, he can really impact the community. He can really make a difference with people, with patients around him. These family planning, maternal health, high-risk cases, all these factors need a very skilled level of consultation. So I would always say to students is to develop their consultation skills throughout their study period, when they go to the hospital, when they're taking histories, they're talking to attendants. They should be very empathetic. They should be very understanding of patient's point of view, keeping the patient first, and then presenting your point of view, how important what you are suggesting is for their health, and how they can trust you. And through research, through logic, through evidence, there's so many ways to prove what you have in mind or what you have as knowledge is so good for them. Seriously, I would like to say again, students should work on their consultation skills, because by the end of the day, your knowledge is your knowledge, but your consultation skills play a vital role in your practice. You would be known in the society. You would be known among your other colleagues at work, at practice, because of your consultation skills. So please go on and start working on your consultation skills. It's an amazing time. You guys are students. You can mold yourself, build up your confidence, go ahead, ask them, and question when taking histories, apply an approach that should be empathetic and based on doctor-patient relationship. When you are taking histories and you are about to diagnose a disease, you are developing a relationship with the patient. And that relationship should be very strong. That patient should believe you, and he should be comfortable in your presence. He should be able to open up about his fears. Because family planning, reproduction, they are very sensitive topics. And a lot of patients, they are very shy. They're not willing to open up about it. They have their fears, society norms that come in play. So you need to be very, very understanding in this approach. Let them open up. Find an approach that encourages them to open and be confident about their what they have in mind. Let them speak out for themselves. So by this is my last slide that I would be finishing up with. Safe motherhood should be, from maternal and child health, safe motherhood is the World Health Organization protocol, and they say means ensuring that all women have access to best health facilities and they go through pregnancies that are safe for childbirth. And this includes healthcare professionals, obstetric emergency, they should be prepared. So safe motherhood goes for all of us. We should make sure that we provide that as being health professionals. Maternal health, I shared this slide previously. I love it, and I like to share it again with you all this time as well. Maternal health is a human right. Women's rights are human right, and this is clearly a human right issue. So keep in touch, everybody. This was the part 2, and I enjoyed my lectures. Hope you guys have any questions. I have provided with my phone number, my WhatsApp, my email address. My email address is sahar.ramiz@gmail.com. Anything that you guys want to have, you want to see more lectures, what are the topics that you have complications in? Probably next one I will be doing with biostatics, because I know students find it challenging. It's one of the major topics of community medicine. Thank you so much. We'll get back to you with other topics soon. Take care. Bye.